Absolutely. I'm really glad to have Kellan here to present. Dr. Baker, I have the privilege of working at Whitman Walker alongside Dr. Baker. I've been working on the clinic side, Dr. Baker working at the Institute. He serves as the executive director there at Whitman Walker Institute, which is the research policy and education arm at Whitman Walker, which is a community health system in Washington, D.C. that also includes a federally qualified health center. Kellan is a health services researcher, educator, and health policy professional with wide expertise in health equity research and policy, particularly with regard to transgender populations. He is a frequent advisor for government and private entities, and he currently serves as an appointed member of a National Academy of Sciences Consensus Study Committee that develops standards for the collection of sex, gender identity, and sexual orientation data by the National Institutes of Health. Kellan holds appointments as affiliate faculty in the Departments of Health Policy and Management at the George Washington University and the Johns Hopkins School of Public Health. And he received his Ph.D. in Health Policy and Management from Johns Hopkins, where he was a Health Policy Research Scholar and Centennial Scholar, an M.P.H. and an M.A. from George Washington University, and a BA with high honors from Swarthmore College. And so I will turn the time over to Dr. Baker to talk with us about the current situation in trans health policy.
Thank you so much, Matt, and thank you, Adam, and the leadership of the HAPI program. I'm very happy, pun intended, to be here with you all today. And looking forward to talking about transgender health policy issues. As you heard from Matt, I have been doing this work for a long time, primarily with a focus on federal and state policy issues. So what I'm going to talk through today is kind of a landscape of where we are with some of the highest priority issues that keep coming up around the health and well-being of transgender people and gender diverse populations more broadly. Just to give you a little bit of background on the Institute, Matt already mentioned we are the research, policy, and education arm of Whitman Walker. Whitman Walker, the clinic, is a federally qualified health center that turns 50 this year. As Matt noted, he is one of our healthcare providers, serving more than 20,000 patients every year from across the DC area. And the purpose of the Institute is to advance the body of knowledge that we need in order to ensure that we are serving our patient populations well, and that we are contributing to broader efforts across the country to reform healthcare systems and reform public health in order to ensure that everyone has the resources that they need to thrive. So these are the topics that I'm going to go through today. Since I can't see the chat, I won't be able to answer any questions that come in while I'm speaking, but please do feel free to put questions in the chat. As Adam noted, I think it would be probably easiest if we save questions for when I'm done talking through this brief set of slides. But I'm looking forward to questions, comments. Please do ask me anything that you want to know with regard to transgender health and transgender health policy. So what we'll be talking through today, before we get to the discussion portion of our time together, is those social, political, and economic determinants of health and health equity for transgender populations. Access to health insurance coverage and general healthcare. This is something that I think is often a point of confusion around transgender health. There's a presumption that transgender health is only about gender affirming care, but actually, of course, transgender people, like anyone, need access to the full range of preventive, acute, and other types of healthcare services throughout their lives. I do then, however, want to look specifically at access to gender affirming care because it is one of the largest areas of policy activity and controversy, both in policy spaces and in the media and public conversations. Then talking just briefly about cultural competency and humility, and about one of my favorite topics, data collection. I am a real joy to have around at holiday parties because my two favorite topics are data collection and insurance reform. So, when I get going, people start backing slowly away. But I'm excited to be among friends today to really dive into some of the weeds about some of these really pressing issues affecting the health and well-being of trans folks. I didn't take a moment to define transgender before I got underway, so I should do that very briefly. Transgender is a broad umbrella term that is used for population, a community of people whose gender identity or their gender is different from the sex that they were assigned at birth. You may have heard older terms. Transgender is really the best way to refer to this population, or just trans for short. And talking about gender diversity, there are folks who identify as men, who are women, who are non-binary. Those are all terms that are used for gender or gender identity. And so again, I use trans or transgender to mean this broad umbrella of people whose gender is different from the sex that they were assigned at birth. So looking at equity and the determinants of health, I am a public health person by, I guess, mission and training, as well as passion. So I think it's really important to contextualize the health and well-being of transgender and other gender diverse folks within this broader framework of the social, political, and economic determinants of health. There are a number of resources out there that describe the impacts of different determinants of health on transgender populations. One of my particular favorites that's relatively recent from 2020 is a report from the National Academies of Sciences, Engineering, and Medicine on the health and well-being of LGBTQI+ populations. LGBTQI+, they're being described as lesbian, gay, bisexual, transgender, queer or questioning, and intersex folks, as well as other populations that fall under this broader umbrella of sexual and gender diversity, such as folks who identify as two-spirit, as asexual, as same-gender loving, as queer. I suppose queer is included in this acronym, but other terms that you may have heard for describing sexual orientation and gender identity. One other quick thing I should say before we dive too far into content around trans issues: gender identity and sexual orientation are different. They are, of course, related, because sexual orientation is often described is the relationship between your gender and the gender of your actual or desired partners. So they are related, but sexual orientation has nothing to do with whether or not a person is transgender or not. And transgender people, like anyone else, can be of any sexual orientation. The term that we use to describe non-transgender people is cisgender, which just means that someone's gender is the same as the sex that they were assigned at birth. So this National Academies report was a follow-up to a 2011 report on the health of LGBT populations. And the reason that we did this subsequent report was for a couple of reasons. One was there was a huge explosion of research and generation of new evidence around the health of LGBTQI+ populations between 2011 and 2020. And we wanted to reflect the new and emerging state of the science. We also wanted to expand beyond LGBT to include, again, some of these newer terms, queer, questioning, as well as the intersex population, which is folks with intersex variations, otherwise known as differences of sex development. Finally, we wanted to expand beyond just the sector of health itself. Health is, of course, a particularly important area for sort of understanding the influences that laws, policies, people's experiences in their day-to-day environments, sort of how those affect people. There are other indicators, however, such as poverty, issues of access to housing, issues of access to employment. And so we wanted this report from 2020 to be more reflective of that broader range of social, political, and economic determinants. So this report, in contrast to the 2011 report, which looked only at health, this report looks more broadly at well-being across multiple different domains. The report's recommendations really focus on data collection. We don't know enough, and I'll talk a little bit more about this later, but we don't know enough about the overall health and well-being of transgender and other gender diverse populations in order to make sure that we are adequately addressing the disparities that we know exist. We can see the broad outlines of these disparities. For example, health disparities such as higher rates of HIV, greater risk of cardiovascular disease, issues related to exposure to violence, but we don't know the full scope of those disparities. And in particular, we don't know how those disparities manifest for trans folks who are living at the intersections of multiply marginalized populations, such as Black trans women, for whom we know some about an epidemic of violence, as well as other disparities affecting their overall health and well-being, but we need to know more in order to ensure that we are crafting budgets, policies, and programs that address disparities. So this is the report. You can see down there some of the webinars that we did in relation to this report, one on LGBTQI+ communities and the COVID-19 pandemic, one on advancing the well-being of LGBTQI+ populations from a policy perspective, and then one on the well-being of Black and other transgender people of color. These are all available on the National Academy's website, as well as these other resources over here, some highlights from the report, as well as issue briefs looking at the different domains covered in the report. And unfortunately, I could spend the entire 45 minutes just looking at the disparities affecting trans populations that are outlined in this report in all of these different areas: education, family and social relationships, community and civic engagement, economic well-being, health and healthcare access, law, public policy, and structural stigma. But please feel free to check these out. These are, again, freely available on the National Academy's website and give a good overview of a lot of the issues affecting trans populations. Some of those major issues I mentioned already: the continuing epidemic of violence against Black transgender women in particular, as well as the continuing burden of HIV and AIDS, as well as COVID-19, which actually there's questions on the Household Pulse Survey, which is fielded by the US Census Bureau, about sexual orientation and gender identity that have allowed us to identify some substantial disparities affecting transgender people, for example, in access to nutrition assistance, as well as unemployment in relation to the COVID-19 pandemic. Another major determinant of health and well-being for transgender populations, and this is kind of getting a little bit away from demography and epidemiology and more into the policy realm. So looking at the landscape currently around non-discrimination, discrimination outside of the area of health specifically, there are a number of factors at play. For example, the Supreme Court ruled in Bostock versus Clayton County in 2020 that Title VII of the Civil Rights Act, that prohibits discrimination in employment on the basis of sex, the Supreme Court found that that definition of sex in the Federal Civil Rights Act includes gender identity as well as sexual orientation, which for many of us is fairly straightforward because you can't discriminate against a transgender person without taking sex into account. But it is, of course, particularly important to note that the Supreme Court has issued a ruling that officially defines sex for purposes of Title VII of the Civil Rights Act to include gender identity as well as sexual orientation. The Biden administration has also been very active with a number of executive orders, in particular one from June of 2022 that lays out quite a broad range of federal activities to protect and promote the health and well-being of LGBTQI+ populations, with a particular focus on trans folks. There's also a number of activities going on at the agencies. For example, the agency, the Department of Housing and Urban Development, released an interpretation of the Fair Housing Act, which it is in charge of implementing and enforcing, indicating that the non-discrimination protections in the Fair Housing Act include non-discrimination protections for transgender people. Some of the less, I would say, health promoting activity around non-discrimination in relation to trans people outside of the specific health realm includes state bans on transgender young people participating in sports teams, state bans on access to appropriate facilities for trans people, particularly in schools, laws like Florida's Don't Say Gay, and of course they mean also Don't Say Trans, laws in schools that prohibit educators from talking about the existence, needs, experiences of LGBTQI+ people, as well as state and federal Religious Freedom Restoration Acts, or RFRAs, which are, this is a comprehensive sort of infrastructure of federal law that has a number of state components as well, that allows for carve-outs of requirements to provide services for service providers who claim a religious or moral objection to the service in question. A lot of these came about in relation to abortion. They are now increasingly being expanded to focus on transgender people as well. At the federal level, there's not a lot happening in Congress. There's not a lot happening in Congress, period, these days. But on the topic of non-discrimination and LGBTQI+ populations, there is a comprehensive civil rights bill, the Equality Act, that would amend the Federal Civil Rights Act to include non-discrimination protections on the basis of sexual orientation and gender identity. It would also broaden the scope of protections around race, ethnicity, ability, language, and other elements of population and individual diversity and identity, but it is unclear whether that bill will receive any further consideration. It has passed in previous Congresses, passed one House or one chamber of Congress, but it has not passed both. This is just, you could show any number of maps these days. The United States has always been a patchwork of non-discrimination protections on the basis of a variety of elements of population diversity. But there is a particular patchwork that is starting to pop up in relation to trans folks and non-discrimination protections on the basis of gender identity. So this is a relatively recent a wave of legislation that bans transgender young people from participating in sports. You can see here, this is actually slightly outdated. It's actually more states now that ban transgender students from participating in sports that are consistent with their gender identity. And this, of course, has health impacts when we're talking about the ability to participate with one's peers, to be part of a community organization, to be part of a team, and then just the sheer benefits of exercise. There are disparities related to, for example, obesity and cardiometabolic disease for transgender people. And a lot of those, the science is looking at links between difficulty being safe participating in sports and issues with health later down the line. These are some of the executive orders that the Biden administration has issued in relation to transgender populations. If you're interested, these are all available online. I encourage you to go take a look at them. The first one here, Advancing Equality for LGBTQI Individuals. This is the June 2022 executive order, the most recent one. There's also a very comprehensive executive order on advancing racial equity and support for underserved communities through the federal government. That is a major piece of policymaking from the Biden administration, trying to ensure that racial equity and other elements of health and overall equity and well-being for different populations in the US are included in consideration in federal policymaking. Looking now specifically at health, and again, this is sort of on the broader level, not gender affirming care per se, but access to health insurance coverage and health care. The major piece of policy that kind of drives or shapes activity in this area is the Affordable Care Act, which was enacted in 2010. I was part of the drafting, passage, and implementation of the Affordable Care Act. I've been doing a lot of that work at the federal and state levels for the last longer than I can really believe. And there's a number of elements of the ACA that have the substantial ramifications that improve access to health insurance coverage and healthcare for a lot of people, and in particular for a lot of LGBTQI+ people and transgender people specifically. So some of the regulations under the ACA revise federal non-discrimination protections for health plans and health insurance marketplaces. There was a proposed rule that came out last year that garnered about 74,000 comments. The US Department of Health and Human Services is in the process of finalizing that rule now. Also, revised federal regulations implementing Section 1557 of the Affordable Care Act. This is the primary, the sort of core non-discrimination provision of the ACA. It incorporates by reference existing federal civil rights laws to prohibit discrimination in health insurance coverage and healthcare on the basis of race, color, national origin, age, sex, and disability. And if you note in there, non-discrimination protections on the basis of sex, the Supreme Court's 2020 ruling around sex non-discrimination protections in employment obviously has some potential ramifications there. There's also, for instance, federal guidance clarifying required coverage of quote unquote gendered preventive screenings. So mammograms, prostate exams, pap smears, the idea that if you got the body part, you should get it checked out regardless of what the sex or gender marker on your ID, on your insurance card, or in your medical record might be. And then more recently, a requirement that insurers cover PrEP, pre-exposure prophylaxis for HIV, with no cost sharing. This is part of a broader preventive services coverage requirement in the ACA. And of course, a number of conservative states have already signed on to an effort in the courts to get this requirement thrown out. So that is a place where RFRA, the Religious Freedom Restoration Act, it's coming up around Section 1557. It's coming up as well around PrEP. And the idea that religious employers should be able to claim an objection to providing PrEP to their employees and should thus be able to opt out of the ACA's coverage requirements. There's also, so I've kind of tried to do here, sort of green is the good stuff and red is the bad stuff. We are seeing some rollbacks, some backsliding on gender identity conversion therapy. These are efforts to change gender identity. There's also a lot of sort of history around sexual orientation conversion therapy, which has been shown to be extremely harmful for the young people and others who are exposed to it. There has been an increasing movement towards banning this unscientific and discredited practice, but we are increasingly seeing states trying to make moves back in the direction of legally allowing transgender people to be exposed to gender identity conversion therapy efforts. Digging into the specifics of gender affirming care, beginning around 2012, a number of states began to institute protections that prohibited what was a common practice, which is blanket exclusions of gender affirming care for transgender people. The types of healthcare services that might be provided to transgender people as part of gender affirmation might include mental health counseling, hormone therapy, and/or reconstructive surgeries. The World Professional Association for Transgender Health is the expert medical association in this area that has maintained standards of care continuously since 1979. The most recent version of those standards of care was released in September 2022. And it outlines, again, those different types of medical interventions or services or supports that might be part of gender affirmation. And this was a major area of change in the last decade before the most recent sort of spate of bans on this care started to crop up. There was a real movement to get rid of these exclusions, to get rid of bans on access to gender affirming care for transgender people. But we are now having a great deal of trouble in a variety of states. Florida, for example, recently instituted an exclusion of gender affirming care in its Medicaid program. There's a lot of legal scholars, legal minds out there who would argue that that is against federal law because the Affordable Care Act Section 1557 prohibits discrimination on the basis of sex, which, as we've discussed, includes gender identity. So having a blanket exclusion of coverage that only targets transgender people on the basis of their gender identity would presumptively be discriminatory. There are also remaining exclusions in plans sold through healthcare.gov, which is the federal health insurance marketplace, and of course, these state bans on gender affirming care for minors, which I hope folks had a chance to read the piece that I shared that talks a little bit about what that landscape looks like. It's really hard to even keep track of this landscape. This is, again, even out of date. We kind of can't keep up with the hundreds and hundreds and hundreds of bills that state legislators are filing to try to make it impossible for transgender young people to work with their parents and with their healthcare providers to identify the services and supports that they might need. So 4 states thus far have passed outright bans: Arizona, Arkansas, Tennessee, and Alabama, and Florida, Texas, and a variety of other states are using administrative means. Of course, not just legislators make policy. Administrative executive branch agencies also make policy, and so Texas and Florida have, unfortunately, I would say, led the way in trying to weaponize their state administrations against transgender people. In terms of looking at what is covered for transgender people in health insurance coverage, we started an initiative 10 years ago, actually, in 2013, called Out to Enroll, which is a public-private partnership that seeks to connect low and middle income LGBTQ+ people with affordable, high-quality health insurance coverage under the Affordable Care Act. There were a couple of different ways that the Affordable Care Act expanded access to coverage. For example, the expansion of Medicaid, which unfortunately has devolved to the states. So the states where there's the highest need for health insurance coverage are frequently those states that have not expanded their Medicaid programs. The other way was through subsidies through the health insurance marketplaces to purchase individual coverage. So we go through every year as Out to Enroll and look at the different plans that are offered through the health insurance marketplaces, particularly healthcare.gov, again, the federal marketplace, to identify which plans do and do not have transgender specific exclusions. So things have been generally improving, actually, we've been doing this research for the last 7 years and have seen a lot of positive change as far as insurance carriers, again, arguably complying with federal law to remove these exclusions and making sure that transgender people can access the medically necessary healthcare services that they need related to gender affirmation. Shifting from non-discrimination and healthcare access, sort of the hard law of what governs access to care, looking now at what we might call the soft law, sort of the elements, the policies and programs and trainings in place on a day-to-day basis to ensure that non-discrimination is not just a nice line of text on a piece of paper, but that it actually translates into people being able to access healthcare services from providers who are prepared and trained to work with them and who are welcoming and respectful of their identities and their healthcare needs. In terms of cultural competency, Washington, D.C. Was the first jurisdiction in the United States to require by law 2 hours of continuing medical education in LGBTQ health for all licensed healthcare providers. And Whitman Walker was one of the organizations that led the charge on getting that requirement instituted. Other states have also taken some steps on this front. For example, California requires continuing medical education curricula to include a discussion of LGBT topics. At Whitman Walker, in partnership with the National LGBT Cancer Network, in February 2022, we released Transforming Healthcare, a guide to best practices in LGBTQI+ cultural competency training. This is the product of several years of work and dozens of individual and organizational experts in LGBTQ health and cultural competency, developing this resource that's freely available at culturalcompetency.org to help individual service providers understand how to work effectively with diverse populations and to help healthcare organizations identify the types of best practices, training, policies that can be put in place to support access to care. And wrapping up now, again, with one of my other favorite topics beyond insurance reform, looking at data collection. And data collection is really foundational. It's really fundamental to all of the work that we do. We cannot effectively map out a path forward unless we know where we are and unless we know where we're going in terms of what are the disparities and what would it actually look like to achieve or at least to advance equity for LGBTQI+ populations and trans populations in particular. There are currently no federal surveys that routinely ask about both sexual orientation and gender identity on an ongoing, consistent, regular basis. The Pulse survey from the Census Bureau, which I mentioned, does have those variables. And so we're very hopeful that that will turn into a longer standing survey, and that those the practices of including those variables will spread to other surveys as well. We look at data collection in three broad domains: general population surveys, such as the Household Pulse survey, then specifically at the realm of health, which is where a lot of issues related to the well-being of LGBTQI+ people come up: health surveys, clinical trials, public health surveillance, electronic medical records, and then administrative data. There are a huge number of administrative systems that process, for example, applications for benefits, access to programs and services, employee records, et cetera, et cetera, et cetera. All of those have the potential to help us learn more using de-identified data about the experiences of transgender and other gender diverse people. As you heard from Matt, the National Academies released a report on collecting sex, gender identity, and sexual orientation data in March of 2022. So we do have questions that we know work for collecting data on sex, gender identity, and sexual orientation. For gender identity in particular, for identifying transgender people, you're actually trying to do two things. You are trying to understand what someone's gender is. You are also trying to understand what some legal scholars have taken to calling gender modality, meaning just should the person be considered transgender or cisgender? And that is often accomplished through a two-step question. One component of the question asks, what is your gender? For example, man, woman, non-binary. And then the second component of the question asks, what sex were you assigned at birth on your original birth certificate? So transgender people can be identified both if they indicate in relation to their gender that it includes some element of being non-binary or has a component related to a transgender identity, or if somebody selects different answers for the two components of the question. As I mentioned at the beginning, we define transgender to be somebody whose gender is different from the sex that they were assigned at birth. So a transgender woman, for example, might indicate that her gender is female or woman, and the sex that she was assigned at birth on her original birth certificate was male. And you can see then that this woman would be considered to be transgender on the basis of the difference between her gender and the sex that she was assigned at birth. The White House Office of Management and Budget and the Office of Science and Technology Policy have also released recent reports on collecting these data. Both of them came out in January 2023. The OSTP, Office of Science and Technology Policy report, is particularly nice. They outline a federal evidence agenda, which is where the White House is asking the individual agencies a series of questions where the federal government needs to know more about the experiences of LGBTQI+ people, and directs those agencies to look at their own data collections and identify opportunities for including variables around gender identity and sexual orientation. The Biden administration is also revising gender markers for passports, making it easier for transgender people to ensure that they have a passport that accurately reflects their gender, and also expanding the gender options to include non-binary, which is something that a lot of states are doing as well. We're also seeing this move into the area of other types of vital statistics, such as birth certificates, recognizing that an increasing number of states are allowing for an original birth certificate to be indicated as non-binary or not specified as male or female. And this is a little bit of the current landscape. Again, this patchwork that we get so often in the United States with regard to how transgender people in this case can change their identity documents. The federal government has jurisdiction over passports, but of course the states have jurisdiction over, for example, birth certificates and driver's licenses. So there's an increasing number of states, as I mentioned, that allow residents to indicate X as non-binary on their driver's license. And then there's a variety of requirements around the type of documentation or the type of process that transgender people have to go through in order to be able to change identity documents such as a birth certificate or a driver's license. There's a lot of different places to look for additional information about all of the pieces that I've talked about today. There's even more than I could fit on this one slide here, but please do take a look around. It used to be when I started doing this work, 15, 20 years ago, there was very little out there on the health and well-being of transgender populations, and that has changed very substantially. In particular, the National Institutes of Health started a sexual and gender minority research office in 2015, and LGBTQI+ populations or sexual and gender minority populations are a health disparity population for purposes of NIH-funded research, which means that any effort that researchers are making to look at health disparities can and should include looking at disparities in relation to gender identity and sexual orientation. So there's a lot of change. There's a lot more evidence, a lot more information than there used to be. But that kind of visibility for transgender people has been really a double-edged sword, because as we have talked about, as I've mentioned quite frequently, there are an increasing number of state bills in particular that are targeting transgender people for exclusion from public life, really. And that are seeking to restrict the ability of transgender people to access gender-affirming care. There is also some movement on this, some bills that have been introduced in the previous Congress that would apply essentially a federal Hyde Amendment. The Hyde Amendment is the annual appropriations rider that prohibits the use of federal funds for abortion. And there has been a lot of concern that there will be a similar effort to target access to gender-affirming care for transgender people in contravention, running directly counter to every major US medical association, such as the American Medical Association, the American Psychiatric Association, the American Psychological Association. All of the major medical associations in the United States have indicated that they do not support bans on access to gender-affirming care, and that they recognize gender-affirming care as medically necessary for the health and well-being of transgender people. So, as I mentioned, there's a lot more resources that are out there, but I would love to be a resource to you all today. I know it can be mind-numbing to sit through a series of slides, so I want to stop with the slides and ask Matt to take us into a discussion. What are some of the things that have been on your radar in relation to transgender populations? What are some of the things that you think about in relation to transgender health policy? So Matt, can I hand it over to you?
Yeah, and just to, sorry, Dr. Myers, was there anything that you wanted to say first?
No, I usually just stick in a couple sentences just to keep it going while people do the transition, but you're doing great.
Got it. All right. Well, so I'll just say for everyone, thank you so much for coming to present. This is a topic that we don't get enough exposure to, I think, and so it's nice to see that this is becoming more visible. And so I think that we will get a fair amount of questions. I'll let people either put them in the chat or go ahead and raise your hand. And as we typically do, we'll start with questions from those in the HAPI program, and then open up to the rest of the audience. So I'll start with Birna.
Hi, thank you so much for this presentation. So as Matt said, I'm Birna. I'm part of the HAPI program and a research interest